Thank you very much for inviting me here to Istanbul to give this presentation, and particularly thank you to Mustafa and the organizers, and thank you to the weather. I come from the Arctic Circle, and this weather suits me more than it's being very, very hot, so thank you for that too. I am a chiropractor, and but the last perhaps 20 years I've been an educator, so and involved particularly then with chiropractic institutions. So there's been a lot of talk about in the previous discussions what a chiropractor is, but I thought I'd put this up anyway and go through it with you, because there are some principles in there. The chiropractor is concerned with the health needs of the public as a member of the healing arts. He gives particular attention to the relationship of the structural and neurological aspects of the body in health and disease. He is educated in the basic and clinical sciences as well as in related health subjects. The purpose of his professional education is to prepare for practice as a primary contact provider. As a portal of entry to the healthcare system, the chiropractor must be well educated to diagnose, to care for the human body in health and disease, and to consult with others or refer to other healthcare providers. So essentially three things. The chiropractor must be able to be a portal of entry into the healthcare system, i.e. a patient should be able to seek advice from a chiropractor directly without being referred from another healthcare practitioner. The chiropractor should also be able to refer to another healthcare practitioner and should have the ability to say whether the patient in front of him is suitable for his treatment or not, which means that he should be able to collaborate with other healthcare practitioners and send patients to them. And also, in many instances, co-treat, that is, treating together with another healthcare practitioner, a physiotherapist or a spine doctor, a surgeon or something like that, in order to provide the best care for the patient. So this is the Anglo-European College of Chiropractic. It's a university college, AECC, in the UK, in the United Kingdom. It's a specialist college educating mainly chiropractors, but it also has other degrees, taught degrees like a BSc in clinical biomechanics, and it has a wide variety of postgraduate studies, both for chiropractors and for medical doctors. It has probably the largest postgraduate diagnostic ultrasound center in the UK, and most of the students there are actually medical doctors. But it is university college, which means that it can award its own degrees. The government of the United Kingdom have assessed the college and said that you are good enough to award your own degree. So it is basically the same as any university in the UK. So aims of the chiropractic program. So obviously, we're talking here about chiropractic education in Europe, but I've taken the AECC University College program as an example. All chiropractic education in Europe are at master's level. So the aim then is to prepare graduates to act as safe and competent primary contact clinicians. We've been over that already. Produce graduates who can deliver the highest standards of care in the context and responding to their community needs in the wider healthcare environment. Is to produce graduates capable of practicing within a patient-centered model with the skills and approach that enable the integration of critically evaluated research evidence, clinical expertise, and patient choice. produce graduates with attitudes and skills that engender lifelong learning and continuing professional development with a view to achieving the highest professional standards. So you can see what the aim of the program is to produce healthcare practitioners that have got an ethical concept about their practice when they graduate. It's to provide graduates with an understanding of the scientific method in the context of a modern healthcare and the knowledge and skills that underpin this. Produce graduates with effective skills of listening, interpreting, and communicating with other healthcare practitioners. So basically, the law in the UK, chiropractors have got their own legislation. So you have to come from a college like the AECC. There are 3 at the moment in the UK in order to become registered by the Department of Health. So you can't call yourself a chiropractor unless you come from an accredited institution and have this education. In the UK, we then have protection of title, which is something that we would like to see across the board. Now, the program at the ACC is a 5-year program, but it has 2 entry points. So if you have a previous healthcare degree or other science background, you will be able to be assessed for what we call prior learning, and you can then enter the program in what we call year 1 and do the course in 4 years. So, funnily enough, then the first year is called year 0, and the next year is year 1. The program is built such that you have 6 core units in every year. Each core unit has 20 credits. 20 credits equates to 200 hours of lectures. So you can see that each year has 120 credits. So as you go through the program, you then do 120 in each year. The level increases as you go on. So in this program, it's called an undergraduate master's program. It means that you start on the master's program from day 1. You do not do a BSc and then a master's. You actually start on the master's program from the beginning. The curriculum is also spiral, such that, for example, in neurology, you would start with fairly basic concepts. Those concepts will be revisited as you go through the years to become more and more complex and more involved until you come to the clinical element, which then translates into treating patients. And also, obviously, the basic sciences are heavy in the beginning of the program. They then taper down, and the clinical aspect is quite light in the beginning, and at the end it's virtually only clinical education. So progression, you have to then have 120 credits as a student each year to progress to the next level. And as you can see here now then, the clinical based education is gradually increasing as we go through the years. Obviously these core units will have other smaller units within them, but I haven't drilled down into the detail. But like clinical management will have all sorts of different levels within them. This goes quickly. We then come to the 3rd year, which is the 4th or the 3rd year. Progression here requires 120 credits at each level. But also in this year, you're going to, the next step is to go into the college clinic, where students spend the final year completely in the clinic seeing patients. So there's also a clinical exam to actually ascertain that the student has enough knowledge to actually be able to start to treat patients. And if a student do not pass that particular exam, then they will not be able to progress. They will be able to, if they fail it once, they will be able to retake it. And if they then pass, obviously they will go forward. But if they don't, then they have to exit the program. And the exit award is a BSc. It's a bachelor's in human sciences. So those students who do not pass the clinical element will exit the program, and they will not be clinicians. They could not practice as chiropractors. They have an academic degree, but they cannot become chiropractors. So you have to pass this clinical element in order then to get to the clinic. The college has a specific clinic building that is designed for chiropractic treatment. It sees about 1,000 patients a week with primarily back pain. It has a rehabilitation unit in there, and it has a very sophisticated imaging department. Imaging is very important for chiropractors to establish the problem the patients come with. And so we have ordinary x-rays, we have scans, we have diagnostic ultrasound, we also have an upright open MR scanner. For chiropractors, we take x-rays standing and we take our MR standing because we want to see the pressure on the spine, which can actually be different from a supine x-ray or a supine MR scanner. It's also an open scanner, so we have a lot of patients referred to us from the medical profession, patients who have claustrophobia, who cannot go into an MR scanner, so this is a very useful tool for us. And the clinic as such is a really important healthcare, providing healthcare for the local community and beyond, actually. So the year 4 then is or year 5 is the last and final part of the program. And as you can see here, the clinic internship has got 60 credits, which means that it's a huge element of the final year. We also have introduced research, and there is a thesis that the students will have to pass. There's also marketing and small business management in there, because the legislation is such that the college will have the graduate students who can hit the street running, as it were, in day one. There's no legislation for graduate education post-graduation from us. So you have to become, we have to deliver a practitioner that graduates from us. In other countries, there is a mandatory 1-year or 2-year graduate education program before you can actually practice on your own. In Switzerland, it's 2 years. In Norway and in other countries, it's 1 year. In Denmark, I think it's 1 year. So this difference in different jurisdiction. But in the UK, you are able to practice directly after graduation. And again, you do have a clinical exit exam as well as you have a clinic entrance exam. So there is a clinical exam that you have to pass as well. And then when you've gone through the program, your degree is an M.Chiro. It's a Master of Chiropractic degree recognized by government. Now, that's the training of chiropractors. The institutions that train chiropractors in Europe are accredited by something called the ECCE, which is the European Council on Chiropractic Education. It's the only pan-European and subject-specific accrediting agency in Europe. It's a member of ENQA, and I think that's been mentioned before. ENQA is the largest quality assurance agency in Europe, probably in the world actually. It has members, I think it's some over 40 countries, so it's not just European countries. There are also countries in Asia that actually are members of ENQA. The ECC is also a member of CCEI, the Council on Chiropractic Education International. So there is a similar organization in Canada, in the United States, and in Australia. And Australasia and Canada and Europe have formed an organization which the US used to be a member of, but are no longer for whatever reason. I'm not sure. But what we are doing is to make sure that the education has a certain standard across the world, which means that students who graduate from institutions that are accredited can move from one jurisdiction, from one country to another, and are able to practice in those countries. So those countries can look at the education and say, this graduate comes from an institution that has been accredited by the ECCE, is therefore educated to a standard that we would allow that graduate to practice in our country. It was founded in 1980 by the European Chiropractic Union, and it credits 10 chiropractic institutions at the moment, 8 in Europe and 2 in South Africa. So why South Africa? Well, South Africa hasn't got their own CCE, so they wanted to be accredited by us. And a lot of the South African, there are 2 universities, University of Johannesburg and University of Durban. Students there are very keen to be able to move out of South Africa when they graduate. Probably one reason. So many of the programs are embedded within larger universities. I've gave you an example of the AECC, which is a specialist university college. But the University of Zurich, the University of Southern Denmark, the University of Wales, there are a number of universities that have chiropractic programs embedded within their university, and also usually with the medical profession. So chiropractors are educated together with the medical profession. So this is fairly dry, but I mean this is aimed really at the university here in Istanbul, because I would like them to be accredited by the ECCE. I think it would be this program here has an opportunity to become a center of excellence for chiropractic. I've seen the university, I've met with the students, and I think the opportunity here to develop the profession within a good university is immense. I mean, there's an opportunity for someone to, like Mustafa and others, to actually build this institution, and accrediting it. The program would be very important. It's a rigorous accreditation process, and there are standards that you have to adhere to. They're updated, obviously, and they're modern. If anyone is interested, go to our website, and everything is there. All the processes, all the reports. There are no hidden secrets. So you can have a look at that. This is a sample of a standard. So this is for you really. New and existing chiropractic programs, they must have a letter from the principal or the head or the boss to seek accreditation, and then they have to write a self-study report and following the standards. The format, as I say, is on our website. Is submitted to something called the COA, which is the Commission on Accreditation, and they will determine whether the SSR, the self-study report, is satisfactory, and if it is, then there will be an evaluation team that will be sent, that made up of educational experts, chiropractors, and we also have students on our teams. There will be a a site visit. They will go and have a look at your program, see what's going on, interview students, interview staff, and then they will write up a report which will then be determined whether that is up to standard or not. So here is an example of a standard. So the institution program must define a curriculum model and educational teaching and learning methods consistent with the objectives of the curriculum. It's
3 more minutes, Ken.
It's not that difficult. I think the last one is quite important, that the self-study report shouldn't be a report which says, oh, we're so good at this, this, and this, and we're doing this, this, and this. It should be a reflection saying, well, perhaps we're not so good in this area, but we have an idea of how to improve upon it. So if you see a report where everything is hunky-dory, you start to think, well, perhaps this isn't right, because there are no institutions that are perfect. An institution that has successfully gone through this process will be awarded accreditation by ECC for a period of 3 to 8 years, depending on the views of its strengths and weaknesses. An accredited institution will be monitored by the ECC through an annual monitoring report. Accreditation can be removed at any time should monitoring show a deterioration of standards. So it's not forever, it's monitored. And also it enhances and improves the institutions. They get better and better through this process. And accredited institutions will have full membership of the ECC Council, so they will be part of developing the ECC in the future. There we go. 1 minute left. Questions, I think, will perhaps come afterwards. Thank you very much for having me.